Welcome back. You're watching Monday's special town hall. And just before we move over to more questions from the audience, let's just have a look at the situation at the Jaramogi Oginga Odinga Teaching and Referral Hospital. Patients trickle into the Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu County with great expectation. This is the largest hospital in Western Kenya region, serving over 100 district and sub-district hospitals in more than 10 counties. Like in many parts of the country, devolution has been a breath of fresh air, but the challenges are far from over.
But KEMSA works on the issue that they must get an LPO before they supply. So if there's a delay in funds, that most likely is going to be absorbed by the private sector. Because the private sector sometimes is able to supply you before the money is transmitted into your account.
Kisumu is one of the 4 counties selected by the national government to test out the dream of universal health coverage. And the supply of quality drugs and other medical commodities is at the heart of the initiative. That mandate falls on the Kenya Medical Supplies Authority, KEMSA, which procures and distributes the supplies to counties. But many counties do not pay for the supplies in good time. At the moment, KEMSA is owed more than 1 billion shillings by counties. Nairobi has the largest debt to KEMSA at 235 million shillings, followed by Narok at 104 million. Kisumu owes about 35 million.
Wakati ambapo bado hakuna pesa, huwa tunaelewa kwa sababu ni lazima pesa iwe released kutoka hazina kuu ya kitaifa. Ndio pesa ije kwa magatuzi, ndio sasa waweze kutulipa. Kwa hivyo hatuwezi kataa kuwa supply na madawa. Kwa sababu hata wasipolipa lazima watalipa wakati watapata pesa. Yeah.
Some residents say things are getting better at the public facilities here.
Mimi mara kadhaa nikija hapa sijakosa lolote. Sasa siwezi nikajua hiyo.
Ni wasiwasi wa binadamu. Kwa hiyo hata ukileta madawa yote, binadamu pia ataendelea kulia. Madawa yenye yako yanatosheleza, lakini binadamu unajua mambo yao.
Health observers have been calling on the national government to allocate more funds to counties and for counties to ensure that money earmarked for health is not diverted to other uses. Mashirima Kapombe, Citizen TV.
All right, the perspective there from the referral hospital in this part of the world, Jaramogi Oginga Teaching and Referral Hospital. Esther, let me come to you because I'll be going back to the audience in a short while. I imagine you're closer to the people here than most of these people. I hope I don't get stoned up here to say that, saying that. But anyway, but anyway, I wanted to find out what your perspective is when you hear people talk about what they find in hospitals, especially with regard to the issue of money. Because I said at the end of this, it's about money. Whether it's about the budgets that we have, the funding for healthcare and all of that. What perspectives do you get and what impact is that having on the people who eventually go to hospital?
I must say that Kisumu County has actually improved because there have been development of what we are calling service charters, which has also included the community members participating. And Kisumu County also has our community health strategy, which means that community health volunteers actually participate in the process of ensuring certain things are done. So we are seeing an improvement in service delivery, but there's still room for more. Because the bit which will ensure quality service delivery means that what is written in service charters must actually be delivered. So when you go there, for example, so I would like to also to see, for example, when you go to a facility and you're looking for youth-friendly services, do they exist for all youth in different places? One of the services which we're also looking at is that it's not what you see like malaria. We look at, for example, the issue of mental health. Do we have proper mental health services at the lowest unit? Because people go for different things. Mm-hmm. So when you see the kind of services that we look at, our service charter must also look at what people are actually suffering from, and not the usual. Probably the person who went there, you can get drugs for malaria, but you will not be able to get efficient services for schizophrenia, for example.
Okay, very, very nice things being said about your county, Prof. I think you will have a very good sleep tonight. But we want to go to the audience now. Mwenzangu Kapombe, sijui una maswali yapi hapo kutoka kwa wananchi?
Na naona hivyo ukianza kuzungumza Kiswahili unasema kuwa tunaweza kujiachilia. Kwa hivyo sasa hebu tuwasikize wengine hapa. Kuna mmoja ambaye anauliza swali kuhusiana na jambo ambalo mumelizungumzia kuhusiana na dawa za TB.
Okay. My name's Eric Okioma. I'm a community health advocate with Kalin. Okay, my question is, it concerns people living with HIV. You hear this county has 134 people living with HIV. That's about 13% of the population. And when people are diagnosed for TB, 50% of them are found to be HIV positive. So my question touches on the issue of cartridges, particularly on the diagnosis of TB, because you use cartridges in the GeneXpert is a machine that is used to diagnose TB very fast. It's faster than using the microscope. But we'll find that in the zones that you have for the GeneXpert, we normally have periodic breakdowns of maybe lack of cartridges for those GeneXpert, taking us back to microscope, which is an old way of doing things. So I know currently the health facilities, the health centers are experiencing, at times they experience shortages of cartridges. That is for diagnosing TB, because GeneXpert is the best way of diagnosing TB among people living with HIV when they go to the facility. And the other bit, which I would also like to know about, what is being done, because if you go down to the health facilities, you'll find that most of them, you'll find that they don't have lab technicians to do that. And that is very risky if you cannot get, because TB is a disease that is very infectious. So I would like to know what is being done about that, particularly the cartridges, that is the KEMSA, in terms of why are they the erratic supply and all those kind of things. And the other things that I've just talked about. Thank you so much.
Thank you for that question. Nitawaomba tu tuweze kujaribu kuuliza maswali mafupi ili tuweze kupata wengi zaidi waulize maswali.
Thank you so much. My name is Mariam Abdallah, a resident of Kisumu County and also a member of civil society in Kisumu. Mine is about the universal health coverage, and I would like to know. I know it was launched in the governor's home place, that is Seme sub-county. We are currently having it going on through the MTBA campaign, but the only information the community have is that it is free. What strategies has the county put in place together with the national government to ensure that the grassroots communities are educated on the universal health coverage? Thank you.
Kulikuwa na swali huu upande mwingine kutoka kwa mwanafunzi nadhani kutoka KMTC ili aweze kuuliza swali lake. Huyu hapa.
Thank you very much. I'm Elvis Ucheng from KMTC Lake Victoria. I was saying that if you walk around in town, you will find a lot of shops. They call themselves chemists and pharmacies. They're actually selling drugs to our patients. We don't know how safe those drugs are, because if you go to most of them, there are no signs that there is a certification for them to do so. So what is KEMSA doing together with the county government to ensure that such is stopped? Thank you.
Naam, kuna swali moja la mwisho hapa kuhusiana na maeneo ambapo dawa zinatengenezwa kutoka kwa Bwana Muyembe hapa.
Thank you. My name is Boniface Muyembe. I work for agrochemical and food company in Muhoroni. Now I have a question. I've attended several tenders in the country, and this is for Dr. Jonah. Normally during this process of tendering, we have local manufacturers like agrochemical. Then we are joined by Chinese and Koreans, and we always fear that the local companies are not being given perhaps fair share of this thing. I would like to thank KEMSA, because Agrochemical actually is supplying KEMSA now. I think is the only company in Western Kenya giving something to KEMSA. But give us a bigger share. Thank you.
Over to you, Joe.
All right, thank you very much. Interesting questions there. So there is the TB question, there is universal health coverage, education from Abdallah, the quality of drugs, the student from KMTC, and of course the Koreans, Chinese, and all these people in the tendering. Bwana Muyembe quite concerned that there isn't a level playing field, as it were, for local, I was going to say service providers, but I am a bit, I'm a bit careful right now. I don't know the TB question. Prof. Dr. Nyango, you want to go? Okay.
Thank you very much, Mr. Kioma, for the very good question about the TB diagnosis and the cartridges. I want to first say that it's good to note that as Kisumu County, our utilization of Gene Expert is the highest countrywide.
What is that, Daktari, in English?
In English, that means if you take all the counties in Kenya and the number of Gene Experts done, we do the highest number of Gene Experts. And so our consumption of these cartridges is actually very high. In JOTRH, we actually have a 16-module Gene Expert machine, which is the most complex of its kind. That's in this region. So it is true we have been having shortages of, Gene Expert cartridges, but...
What does that thing do? I'm just hearing...
Well, Gene Expert is a machine that if, for instance, as Okioma said, previously if you were coughing and we needed to test you for TB, then we take your sputum and we put it under the microscope. But Gene Expert is a machine that takes the sputum and processes the DNA to be able to tell you whether you actually have TB or you do not have TB.
Okay.
So it's a lot more
Thank you. I know there are people who are just smiling like me, but they were not understanding. So thank you.
Yes.
So thank you very much.
So the Department of Health is aware of this shortage or, these shortages, and I think they have been episodic, and we've been working with the National TB Program to be able to sort out those issues. And sometimes, and I think as John noted earlier on, there are some program commodities. And the program commodities are coordinated between KEMSA and the program. In this case, the TB program. And so sometimes we have engaged the TB program over and over again to be able to sort out, but they have assured us, because the cartridges are bought through Global Fund, they have assured us that there are plenty of cartridges. And so we will be able to improve on the supply of cartridges as time goes.
Okay, let's deal with the universal health care education. The only thing people know is that it is free. I'm not too sure that that is completely true, but yes, that apparently is the only information that people have.
Which is a very wrong information, by the way. And what was launched on the 8th of August in Kombewa was not really universal health care. We launched the registration of people into NHIF. In fact, we launched a process, a campaign for people to register as NHIF card holders so that you can get that, what do you call it, Dickens?
So that you can get the cover, the super cover.
You can get super cover of an NHIF, but you have to be a member.
Yeah.
So that you can get super cover, so that whatever level of health system you go to, you will get treatment. The good thing with NHIF, when you're super cover, is you only pay about 500 shillings.
500 shillings per month.
500 shillings per month?
Yeah.
But when you are sick and you go to Agaka and you are slammed with a bill of 65,000 shillings, you are covered. So we must teach our people the logic and usefulness of having health insurance. Health insurance. Nothing in this world today comes for nothing. Ex nihilo, nihilo. From nothing comes nothing. So that's one. Secondly, there are about 300,000 people in Kisumu County who are called indigents, who cannot afford even 500 shillings. Those people, we in the county government will pay for them to be members of NHIF. Okay? So let's get that very clear. You able-bodied Kisumu citizens who work, who have a garden, who can go to the market and sell a chicken and get some money back, you have to pay. But the indigents, like old men who can no longer get any income, a young person who is from poor parents, and we have identified them, they're about 300,000. We shall pay for them so that they don't become a burden to the household, so that they don't become a burden to Harambe being held to give them hospital bills. That's what I'm saying.
Okay,
so, but secondly, we have been very poor.
That is the third point.
Let me say, we have been very poor at educating the public. And I'm always telling Dickens and the CS in charge of health, Dr. Rosemary Obara, that you must educate people through FM stations. Go around like Udula used to do when I was a young man, showing people movies in the countryside.
But is that really just the work of the county government? I thought that community-based organizations, civil society would also be involved in this, because if you're really looking for universal health coverage, surely someone said everybody's business, no?
I mean, they should, but I'm talking about my county. I don't want to hold their brief, you see. But they should.
No, I'm asking her. I'm asking her now.
The bit of this is that we need to be very clear about the health financing. And that is why participation by community members on community-based health financing is critical. And at that level, it is very important that health information systems, and health information systems is nothing about computers. Health information systems includes activities which are held within health facilities. And those activities held within health facilities should reach out to community members and give that information.
Okay.
So when this lacks, or it is not rolled out as fast as is needed when this is being rolled out, then we have the challenge where community members are not aware of what is going on, even in the nearest health facility. So it means that we need more engagement at the lower unit. And that is why it is important sometimes when community health volunteers are engaged to reach out and speak with people. And we say that sometimes it's easier to speak with people not on radio, because maybe not everybody, and we have gender issues on radio, for example. Because who is listening to radio at what time and who is changing what channel? So which radio channel are you going to be used? Or for example, if you're going to use another medium and use newspapers, how many people are literate? So the bit of using certain spaces within community level is critical. Okay. So that community engagement at that level needs to be enhanced so that we reach people at the village unit.
Okay. Thank you.
I would amend that. No, I would amend that. I would say let's use all means possible. Be it radio, be it community members, be it musicians, be it clowns. Let's use all means possible to reach the people. I would not be dogmatic and say that you don't use radio because people don't listen sometimes. We don't know what time people listen to these radios. So let's use all of that.
Okay, fair enough, Prof. Dr. Manjari.
Yes.
Yes. Your question touched a little bit on the chemists. I don't know how much of that you answer, but also the question that Dr. Muyembe asked.
Yes, I think I want to say that in KEMSA we have two types of tender. We have open international tender and we have open national tender. When it's an open international tender, an open national tender, there are only three things that are required for you to be successful. Do proper documentation. Everything that is required, do it right. Give us the right sample of high quality that when it's taken through the quality assurance, it passes the test. And the third thing, be of good price. So when it's evaluated, we usually award the lowest evaluated bidder. So when it's a bidder who is outside the country, is not in Western, then we go back to the procurement. It also allows that we favor local manufacturers. We favor persons who are disadvantaged. All those put in place, there is no one who is disadvantaged. But when we go back, the issues of the chemist, Professor said, is the issue of the KEBS and Pharmacy and Poisons Board. If there are issues that are surrounding all those unauthorized chemists that are running, it is you, Mwananchi, who should actually be the person to be a whistleblower. It is you to tell us. But I also want to go back and support the professor when he says that universal health coverage is actually basically leaving no one behind. Let's all go the same direction. At the same time, it's what we call continuum of care, from crib to cradle. And then when you go back, look at three things. Look at money, manpower, and management. When all these things are not put into perspective, you'll only be discussing universal health coverage that will not be realized because you have not put things into perspective.
All right, Daktari, we want to go back to the audience a little bit because our time is running out here. Mashirima.
Ya, kwa sababu hivyo basi tutampa mmoja nafasi. Nadhani kama ataweza kuongea kwa fupi basi tutapata mwingine, lakini akiwa na maneno mengi itakuwa yeye tu ndo atapata nafasi hiyo.
Thank you so much. I would want to ask my governor whether he is aware that for us to gain universal health coverage, we also need to have our facilities at the grassroots supported properly and enhanced. You'll find that in most of our facilities, probably the only simple test that one can get there is malaria test. Yet, we still have people who are dying outside there of amoebiasis, dysentery, and bilharzia. We need testing facilities at the grassroots. 2, we also need our women who are actually supposed to be getting medical support when they are delivering. We also need those facilities down there. For example, where I'm coming from, we have a facility that is empty. It has not been facilitated in terms of beds and the capacity there. Many women are suffering. We would want such facilities to be enhanced. That will help, in getting the medication that our people need. It will also help in decongesting the systems that we have at Jaramogi Odinga and probably Lumumba and such other places. The last one is we have a problem of liver cirrhosis, liver problems coming up because of drug abuse, particularly by the youths. A majority of us wazees are now not taking much alcohol. There is this problem of waragi. What is the county government of Kisumu doing to help prevent this devastating effect of waragi and the content of alcohol that our people are taking, so that we don't have those issues of our boys vomiting blood, diarrheaing blood, and help ending up with those problems of liver cirrhosis?
Thank you for that question. One more from a lady, gender balance.
Thank you. I'm Ruth Eli Dotieno, resident of Nyalenda and also a member of Kisumu Informal Settlement Network. My question is to the governor. Why the resources are put in curative, yet we need to deal with preventive in order for us to avoid spending much money, whether it is on the universal coverage, because I believe those old people, when they are well taken care of at the grassroots level, then we won't have them going to the hospital. And again, we also have people in the informal settlement who are living in pathetic conditions because of poor environment due to uncollected waste, because the cleaning is mainly done along the ring road, while in the estates we have uncollected waste which are not addressed. What are you doing about it? And also the poor sanitation due to the weak soil and also the high water table within the informal settlement. What are you doing about them so that we can reduce the communicable diseases?
Thank you for that. Joe, take over.
All right, thank you very much. I realize the people in Kisumu don't speak in Kiswahili, so I'll check that with the governor later on. But we want to finish this, and what I'm going to do is to ask each one of you to pick the questions that are relevant and answer them as you make your closing comments, because we have to finish in the next few minutes. And I will just start from that end. Dr. Onyango, we come and we'll finish here.
Okay, so I think there has been a question about facilities at the grassroots being supported.
And let's keep it brief, please.
Okay,
Thank you.
Being supported to offer laboratory services. And I think the questioner is actually very accurate, that we actually have labs in hospitals and then some health centers, but in most dispensaries we do not have labs. But also we do have shortage of lab personnel. So for us at the health department, what we have come to realize is that this calls for some innovative solutions. And there are some people that we are already in discussions with who have innovative solutions in terms of having gadgets that you can be able to use to make a diagnosis without a laboratorian. You could have very simple gadgets that can run a panel of tests that can return very quick results, and we are working to get those solutions. And I think a good example that a favorite of our governor is clinic in a bag that somebody came with, that you actually have a small bag that really can be able to do a battery of tests. And I think also the issue of delivery services, I think we've been expanding the issue of having every single dispensary to be able to have a capacity to deliver mothers. And I think our policy is that every facility should be able to deliver, and we'll work on being able to implement that.
Thank you.
Yeah.
Let me stop you there. Thank you very much. Esther?
From our perspective, we need to strengthen the community health strategy, because with that community health strategy, then the voice of the citizen will be there, because you will be able to participate. And within that, then ensure that when community members are participating in the budget-making processes, which we are already started, the plans, which, for example, what we call the ADP, has also the community voices. Prioritization of the community members are also included within that space. So that particular participation of community members within the budget-making process, particularly within certain sectors like health, is going to be very critical, so that our issues are included in that space and are actually part of the programs which are rolled out. Then it means that we are able to talk about what then we need as community members.
Thank you very much, Dr.
Yeah, most of the questions were actually to the governor, so I'll only make one or two comments. One of them is that as we look at the issues of liver cirrhosis, we need also to remember that aflatoxin does contribute a lot to liver cirrhosis, not necessarily issues around alcohol. But at the same time, I want to say that one of our mandates as KEMSA is to enter into strategic partnerships. So we will continue engaging with citizen royal media and the counties, and especially Kisumu County, as we assist them to attain the universal health coverage. Thank you.
All right, thank you.
Yeah.
Governor, take this home, as they say.
Two very good comments and questions. First, about facilities not being properly equipped. I agree with you. What we have done in this county is do what we call a gap analysis. We have taken up the responsibility of analyzing all facilities from the dispensary up to Jaramogi Oginga Odinga Hospital to find out what gaps exist in terms of equipment and human resources, what we need to do to fill those gaps, and how much money we require. So that exercise is complete. During the year, we are going to be dealing with it, and we hope that by the time we finish the pilot project, most of these gaps will be filled. But the first gap to be filled is in completed projects, like the maternity thing at Kisumu County Hospital. That must be done. Yeah. Secondly, Jaramogi Oginga Odinga Teaching and Referral Hospital is crying for a facelift, and it needs a lot of money. We have committed about 100 million shillings, I hope, to deal with Jaramogi Oginga Odinga Teaching and Referral Hospital. We want to be a real referral hospital. That money is not enough, but at least for this year we should deal with that. And then we can incrementally do it over the next 5 years. Now, finally, to the question about Waragi. As chairman of the security committee in the county, I raised this issue with our security brothers and sisters in the county. You know, I don't have a police force behind me, unfortunately. So they have to do it. So it's a security issue. And I think they responded. They have done some raids, and they're trying to keep Waragi from entering this county from Uganda. We hope they will succeed, but give them some support. Coming to Ruth. Ruth, you know, cleanliness is next to godliness. You begin by keeping your own house clean and your neighborhood clean. And then the waste that is collected can then be delivered to wherever the waste is collected, and we shall get rid of it. Now, certain communities in this city have started their own systems of collecting waste and delivering it. I think that kind of self-help is important, but we shall do our best to make sure that we expand cleaning the city and collecting waste everywhere. It requires resources, and the more we have the resources, the more we shall deal with it. And finally, you are right. Prevention is better than cure. And one of the reasons why we are investing in community health workers at the family level is because we want them to do two things: to do preventive health care and primary health care at the grassroots level in conjunction with village councils. That is something that we are going to do, and we hope that by the moment we have implemented that fully, the idea of preventive medicine will sink into all families' culture under the grassroots. It's a matter of cultural practice. How do you help the county government and yourself to get involved with preventive healthcare?
All right, thank you very much, Professor Anyang' Nyong'o. Wrapping up our discussion here in the county of Kisumu, we have been discussing the state of health in the country in the wake of all these plans for universal health coverage, and that is going to be a big conversation in the country going forward, and we want to be part of that conversation. That is why we have Monday Special Town Hall coming to you every Monday night, and next week we'll be in a different county. It could be your county, so you need to stand by. But for now, it is good night from me, Joe Agayo, and my colleague Mashirima Kapombe is somewhere in the crowd.
Kutoka kwangu mimi ni Mashirima Kapombe hapa kwenye ukumbi wa chuo cha Tomboya. Usiku mwema.